So assalamu alaikum. In this video we'll take a look at the other two bones of the upper limb, that are the radius and ulna. Now these two bones are forming the forearm, this region. So medially we have the ulna bone and laterally we have the radius bone. So first of all we'll take a look at the radius and then we'll talk about the ulna bone. So whenever we talk about any bone, we talk about its side determination, that which side's bone it is. Like in case of radius, it's quite easy to apprehend because the upper part is quite smaller while the lower part is quite expanded. In contrast to ulna, which is on the upper part it is expanded and on the lower part it's having a small head, right? So in case of radius, we are having a small upper rounded disc shaped head, and on the lower end we have the expanded portion that is having a solid process laterally. Okay, so if we talk about its various parts, so it has the upper part having the head, disc shaped head, the shaft, and on the lower part we have the you can say the expanded portion or the portion with the solid process laterally. Okay, so if we talk about first about the head, so the head is having a hyaline cartilage and another ligament around it, right? And this head is basically going to be contacting the radial notch of ulna, जो हम बाद में देखेंगे, and that radial notch will be forming the superior radio-ulnar joint actually with the head of the radius, right? And on below the head we have the neck, right? And below the neck we have the radial tuberosity, which comes in contact with the a notch on ulna, right? So these are the features of the upper part of the radius bone. Now the head basically comes in contact with the humerus on its capitulum and forms the elbow joint, right? So basically the upper part of the radius is forming two main joints, the elbow joint with the capitulum of the humerus, and the superior radio-ulnar joint with the radial notch of ulna, right? So these are the two parts, important parts of the upper part of the radius. Then we have its shaft, and the shaft is having certain borders and certain we can say surfaces. So we have the anterior border starting from the radial tuberosity all the way till the styloid process down, and then we have the posterior border again, जो कि एक तरह mirror image होती है anterior border की, but it starts basically from the it's basically only print on its middle part, और जहाँ पर हम इसको posterior oblique line भी कहते हैं. So middle of the anterior border forms the anterior oblique line and middle of the posterior border forms the posterior oblique line, right? So then with the third border is basically interosseous border, जो कि basically होता है in contact या in towards the ulna bone, और medially lie कर रहा होता है, between the two bones होता है, like you can say towards the other bone होता है. And interosseous border में हमेशा interosseous membrane लगी होती है जो between the two bones present होती है. Now these हो गए तीन borders. Then we have the three surfaces. The anterior surface again present होती है between the anterior and the interosseous border right here, and the posterior surface is present between the posterior and the interosseous border हमें नजर यहाँ पर नहीं आ रही है, and the lateral surface is present between the anterior and the posterior borders. So ये तो हो गए तीन borders and तीन surfaces. Then the lower end of the radius is such that it is expanded, right? Anteriorly it will be having a longitudinal ridge जिसके ऊपर आप अपने radial pulse भी measure करते हैं from the radial artery, and laterally there is a expanded portion, or you can say there is a elongated portion called as the styloid process, right? So यही important parts हैं किसके lower end of the radius की जस्ट आपको expanded portion. अच्छा, one more thing, हमें posterior aspect of the radius पर lower end of the radius के posterior aspect पर हमें कुछ grooves नजर आते हैं, which is the grooves for the extensor tendons, जो कि forearm के extensor muscles होते हैं जो हमने forearm के compartment में study करेंगे, अभी इसकी ज़रूरत नहीं है. And in addition to the four grooves on the posterior aspect, we also have the dorsal tubercle of Lister, जो कि हल्का सा tubercle होता है the lower end of the posterior surface of the radius bone, right? So ये होगी important aspects of it. Then the ulna bone is there. Ulna is basically, अच्छा ये तो radius है ना, ये highlighted bone नहीं है, that is the ulna bone, ठीक है? Ulna will be lying medially to the radius and it's also one of the bones of the forearm. अब इसके important features दे लेते हैं. Again it's having an upper end, a shaft and a lower end, right? अब upper end थोड़ा expanded है as in contrast to the radius bone, ठीक है? तो इसकी कुछ processes होंगे, कुछ उसके में foci नजर आएंगे, and the posterior and the lower end will be quite you can say smaller, and it's only having a head जो कि attach होता है या you can say articulate करता है with the ulnar notch of radius, right? So ये हो गए इसके important parts. अब इसको one by one study करते हैं कि कौन कौन से इसकी साइड डिटर्मिनेशन ईजी है. जो उसका अपरेंड होता है थोड़ा हुक शेप्ड होता है. हुक शेप्ड कैसे नजर आता है हमें, इस तरह से हुक शेप नजर आता है. सो जो हुक शेप पोर्शन होगा वो हमेशा उसका अपरेंड होगा, जो स्मॉलर पोर्शन होगा हमेशा उसका लोअर एंड होगा. तो आप इस तरह से उसकी साइड डिटर्मिनेशन कर सकते हैं. सो जस्ट लाइक वी हैड द styloid process ऑफ रेडियस जो कि लेटरली पड़ा होता है, इन एडिशन इन द सेम वे देयर इज अ styloid process फॉर ulna एज वेल, जो कि मीडियली या पोस्टोमीडियली पड़ा होता है ऑन इट्स लोअर पार्ट, राइट? दोनों का styloid process हमेशा लोअर पार्ट पर ही होगा, अपर पार्ट पर नहीं होता. अच्छा, नाउ इट हैज़ अ Electron process and a coronary process, जो कि कैसे नजर आते हैं. These are the beak shaped processes. So this is the Electron process जो कि upwards lie कर रहा होता है, and the other one is the coronary process जो कि downwards हमें नजर आता है, and these both processes are forming a notch. This notch is called as a trochlear notch, and this trochlear notch basically comes in contact with the trochlea of the humerus, right, to form the elbow joint. So in case of radius, we had the you can say that एक portion था which came in contact with the capitulum, which was that portion that was the head of radius, right? But in case of ulna, there is a notch called as a trochlear notch comes in contact with the trochlea of the humerus to form the elbow joint. So these two bones are coming in contact with the humerus to form the elbow joint, right? So in addition to that, there is a radial notch comes in contact with the head of radius to form the superior radioulnar joint as well. So radial notch and the trochlear notch are the two notches जो कि superior radioulnar joint और elbow joint बना रहे होते हैं, and this is the olecranon process and this is the coronary process, and the notch in between is the semilunar notch or the trochlear notch, right? So अब इसको हम देख सकते हैं separately. So this is the olecranon process and this is the coronary process, and this is the notch. अच्छा, then this is a shaft and there is the lower part of as well. So in case of the olecranon process, is having an anterior surface, right? It has a posterior surface, anterior surface, medial surface, lateral surface and superior surface. So हर एक process के parts होते हैं. जो anterior surface होता है that is quite articular और वो upper end of the trochlear notch बना रहा होता है, right? And जो उसका होता है, you can say the inferior surface of this olecranon process inferior तो नहीं होता खैर, लेकिन medially and laterally भी सेम ऐसे ही होता है, उसके shaft के साथ नीचे continue कर जाता है. And then इसकी जो posterior surface होता है जो यहाँ पे नज़र नहीं आ रहा, but इस तरह से ये mostly subcutaneous होता है, and whenever surface is subcutaneous वो हमेशा हम उसको separate करते हैं from the skin through a bursa simply a you can say fat filled or skin filled, or मतलब it's like a pouch, like a fat filled pouch. So between the skin and this bone there will be a fat filled pouch जिसको हम कहते हैं bursa होती है यहाँ present, right? So ये सारे surfaces हो गए. In addition there is also superior surface of it जो कि फिर posterior part you can say continue हो जाता है. Then the next process is basically the coronary process, and this is the coronary process. Again it's having certain parts like a superior surface होगा, इसका anterior surface होगा, lateral surface होगा और medial surface होगा. So this is the coronary process. अच्छा, on the superior surface of the coronary process there is will be forming the lower part of the trochlear notch as you can see, right? And the upper part of the lateral surface is marked by radial notch, right? You can say lateral surface में radial notch नजर आती है जो कि articulate करती है with the head of the radius, right? So this lateral surface is there. And then we have a medial surface of it as well. So medial surface contains with the medial surface of the shaft downwards. So ये होगा इसके parts. Then we as we just discussed that there is a notch, that is the trochlear notch which comes in contact with the trochlea of the humerus to form the elbow joint, and there's another notch called the radial notch and comes in contact with the head of radius to form the superior radioulnar joint. अच्छा, then there's a part of the shaft as well, हम already study कर चुके हैं. There will be an anterior border, a posterior border and an interosseous border. Interosseous border हमेशा दूसरी bone की side पे होता है जो इसके ऊपर हमारे पास attach हुई होती है, interosseous membrane as well. And then the anterior border will be thickened and rounded as you can see, appreciate here, right? And the posterior border will again be there and it will be slightly subcutaneous. Anterior surface present होता है between the anterior and interosseous border, right? And posterior surface will be present between the posterior and interosseous border, and the medial surface will be present between the anterior and the posterior border. Lower end की बात की जाए तो बहुत ही easy सा है. There is a head, right? And there is the stellar process laterally. So these two things will be present there, and there will be an ulnar artery and the ulnar nerve passing over it. जो कि फिर बाद में पाम में एंटर कर जाती है. सो in addition to that we also say that the extensor carpi ulnaris tendon passes between the stellar process and the head. So now these tendons you have not studied yet, but they are present there and we will relate them जब उनको हम individual study करेंगे in the forearm compartment. एक चीज़ मैं मिस कर गई थी, that was when we talk about the lower end of radius. So this is the lower end of radius bone, and it will be forming a wrist joint as well, right? So wrist joint की कुछ bones होती है जो कि articulate करती है definitely with the radius bone, and they will be separated from the those bones by an articular disc here, right? So there is scaphoid bone and there is lunate bone. So scaphoid and lunate both comes in contact with the lower end of the radius or the inferior surface of radius to form the wrist joint. So these are also the relations of the lower end of radius, that is the scaphoid and the lunate bone will be coming in contact with it. So that is how the wrist joint will be formed. So that was all about it. So with this note we are basically done with the radius and ulna. Thank you so much. Allah Hafiz.